This year, healthcare premiums are through the roof. I am not kidding you when I tell you my premiums are up 17%. That's 30% over the last 2 years. I have a friend whose premium has increased 5,000%. So instead of paying these outrageous fees, I'm going to share with you 12 tips that I'm implementing this year to save thousands. In fact, I will be saving about $500 a month just in my healthcare costs. So if you're ready, let's go ahead and get started. Before we get started, I just want to remind you that I am not an insurance expert. I'm just a girl on YouTube who wants to share how she is doing and what she is doing to combat all of these healthcare prices this year. And if you like this video, give it a thumbs up. Don't forget to subscribe, hype it if you can, but see a professional for specific advice related to you, because I'm not a financial advice person either. I'm just a random girl here. So let's go ahead and start talking about how I'm going to save about $500 a month this year in the strategies that I'm implementing. So hopefully one of these strategies or more might be helpful to you as well. And I'll also share with you at the end how my friend whose premium went up 5,000%, what she is going to do in order to make it work for her this year. So the first thing that I want to share with you is you do have control over options, right? So every year we have an option to look at our insurance and adjust it every year. When we make a decision, it's only for 1 year. So we need to think about, what does this future year look like? What am I willing to spend my money on? And what am I willing to pay someone else to take on the risk for me? So we have to think about that whenever we think about insurance. Some of it we is our payment, and some of it we pay someone else to insure for us. So before we get started, I want to give you just a very generic overview, very basic overview of the different terminology in insurance. So it's not that easy to kind of work through, especially if you're not like an insurance person or you've never done it before. So there's just a few things that I think are important to kind of remember when we're looking at our insurance choices. And the first thing is a premium. So what is a premium? If you are employed, generally you will pay a lower premium. And when I say premium, that is like your monthly fee for the insurance. So if you work for an employer, typically an employer will pick up part of that cost or all of that cost if you're lucky. Other employers will just pick up part of that cost or sometimes even none of that cost. So if you're working, your premium is what you pay every month, like your Netflix subscription or whatever subscription you have. It is what you pay to the insurance company to receive benefits, whatever those benefits are. So for me and my family, our employer pays for 2/3 of the premium, and then we pay for about 1/3 of the premium. That's also called a benefit, by the way. So you can kind of like look at that whenever, if your employer's doing a really like amazing thing and paying for all of it, you can think about that as being a bonus to your salary or part of your payment, part of your salary. Now, if you are not working for an employer and you have to get it through the healthcare exchange, Affordable Care Act, that is when they'll share with you your premium and how much it is. But then there's also a subsidy that's paid by the government, i.e. the taxpayers. So if you are someone that has to go out on the exchange and get your own insurance, meaning no employer helps pay for part of it for you, this is your option, then you will see on there a premium and you'll see a subsidy. So you will pay basically the difference between the subsidy and the original premium. They'll tell you what your cost is going to be. That's basically really a rebate, but they actually let you pay the fee and then they take care of that kind of rebate later. So I'm not really a huge expert on that, but just wanted to let you know that when you're on the Affordable Care Act website, the Healthcare Market Exchange, healthcare.gov, whatever that is, you do have a premium that you pay. And then the subsidy comes from the government, i.e. the taxpayer, so that you have a reduced premium. What you pay is reduced. Now, it has gone up this year. Not only has insurance gone up, but the subsidy has gone down as well. And so you might see your premium even, double in some cases, like my friend thousands of percent more. So make sure that you kind of at least understand a little bit about what the premium is. It's basically what you're paying. And then you either get no subsidy or you get a subsidy from your from the government through the healthcare exchange, or your employer pays part of that as part of your benefits package. So that's called a premium. You pay it every month, comes out of your paycheck, or you pay it however you pay it with a credit card or whatever, depending on your situation. The next thing is a copay. So a copay is what you pay when you go see a doctor. So it's like your portion of it. Usually it can run anywhere between zero up to hundreds, right? Depending on what your plan has. So in my my copays this year will be cheaper. Typically they've been about $35 to $50 if I need to go see a specialist. This year I'm actually reducing that. The next thing is a deductible. So a deductible is what you have to meet before other things kick in. Usually it does not include like your standard office visit. So if you have a lot of insurance companies will pay for an annual exam, which usually, in many cases will be free, right? As part of what you're paying for as part of your premium. And then you wouldn't have to use a deductible for that. But you would have to use a deductible for things like an emergency, like an emergency room, or let's say you needed a surgery, then you would pay a deductible, whatever that deductible is. So you want to look at your deductible to see like how much is it? Can I afford it? What am I planning? There's a lot of things we need to talk about, but that is what a deductible is. The next thing is coinsurance. So once you meet a deductible, then you come in also with your coinsurance, and that is what you pay out of pocket. So your coinsurance might be 30% or a certain percentage or even a dollar amount. So if let's say you're going for surgery and you've met your deductible, then your coinsurance would kick in and you would pay a certain percentage of the fee. It gets more complicated than that, but that's what coinsurance is. The next thing is out-of-pocket maximum. So out-of-pocket maximum means like this is the most you're going to pay in a year. That's the most your healthcare generally will cost you related to your specific policy. So let's say your out-of-pocket maximum is mine this year, 2025, was $15,000. So if I had a big emergency, if I had a tragic diagnosis and I had to pay a lot out of pocket, then my out-of-pocket maximum would have been capped at $15,000. So that's what an out-of-pocket maximum means. Now, I encourage you to make sure that you look at your policy to make sure you understand everything related to your policy, because obviously I can't share everything in this video because every policy is different. Everything is different. Even your own circumstance is different. So be sure that you're paying attention to these things. So now that you know the basics, let's talk about how you can save money like I'm saving money this year. So the first thing is to not auto renew. This is where I have spent the most money overpaying for insurance, is simply by being lazy and auto renewing. I have estimated that I would have today $25,000 to $30,000 in the last 5 to 6 years simply by not being lazy and auto renewing. So don't auto renew your insurance unless you want to. I mean, you just really, what I'm saying is understand the choices that you're getting every year and then pick the best one that suits you for that year. Remember when I said earlier that your insurance is only for a year. So you don't have to plan for 5, 10, 20 years down the line. You only have to plan for a year. So if you believe that you have a surgery coming, but it's not coming for the next 5 to 10 years, or it's way down the line, you don't have to plan for it this year. Take care of yourself, but you don't have to plan for it in your insurance. If you think you can go a whole year without a major surgery, then you want to really think about that in terms of maybe you can get a cheaper plan like I'm getting this year. Now, will something happen and may you have a tragedy? I hope not, and I pray not. But if you do, then you have to realize if you took a lower plan, chances are you're going to have more out of pocket. So everything is a give and take and a risk analysis that you have to do on your own because nobody else is going to do it for you. So don't auto renew. Look at all the choices this year and then select the one that's best going to work for you for the coming year. That is my number one tip. If I would have been doing that, I would have, again, $25,000 to $30,000 in my hands today if I wasn't so lazy about it. So this year, I'm not going to be lazy about it. This year, I am working to make sure I know what I need for next year as best as I can and plan to, whatever I can, reduce the risk of needing a premium plan. So, number one was don't auto renew. Number two, review what you're actually using and consider what you need for next year and consider what your plans are for next year. What do I mean by that? In my benefits package, and I'm sure it benefits program. So, whoever your provider is, if it's Blue Cross Blue Shield, United Healthcare, whatever it is, usually they will have an explanation of benefits section. If you go to the explanation of benefits section, it will tell you exactly what you used this year. It'll tell you like who you saw, it'll tell you what the charges were, it'll tell you what they paid on your behalf, and it'll even tell you what you paid. You can actually, in many cases, download this file as an Excel spreadsheet, which I did this year. And then I looked at everything that my family has used, and I was surprised that we were not using a lot of healthcare. Like it was not a lot of money. I think maybe we paid more in premiums this year than we actually got out of it. So, word to the wise, actually go in to your explanation of benefits, look to see if you can download your actual healthcare usage, and then look and see what is it that you're using and what are they paying for, and can you make an adjustment and find a different plan that works better for what you're actually using. Then you have to think about, what am I doing next year? Is 2026 a year that I have a knee replacement? It's not going to be. Is it a year that I have, something going on that I know I need to get fixed next year? For me, that's not the case. For some people, it's like, oh, I need my hip replaced. I need my knee replaced. I need some neck surgery or whatever. If you have a major surgery planned next year, get the best plan you can get because it's probably going to do better for you. But if you don't have a medical big deal coming up and you think it's going to be relatively chill, then you can go down to a lower plan, which is what I'm going to do. So what I found is, based on my usage, I don't have to have the premium plan. So as I looked at the figures this year, the premium plan that I was on 2025 was going to go from $304 to $357 per pay period. So that's a lot of money. That's thousands and thousands of dollars every year. However, if I switched it to a cheaper option, my premium was only going to be $158 per pay period. Guys, that's like over half. I'm saving over 50%. Okay, let's talk about my risks though. Obviously, going from a premium plan to a less, premium plan is risky. So let me share with you some of the risks that are involved in this decision that I'm making. Number one, I'm going from a zero deductible plan to $1,500 deductible. So if something happens and I have to have a major surgery, or if I have to go to the emergency room, or if the kids are going to the emergency room, I'm going to have to pay $1,500. So I better have that $1,500 ready to go, because chances are no one's getting out of the emergency room under $1,500. Okay, but that's not all I'm going to pay. Let's continue. The next thing was my out-of-pocket maximum. So for this year, with the premium plan, my out-of-pocket maximum was $15,000. Next year, with the inferior plan, it's going to be $20,000. So if there's a big catastrophe, I may have to come out of pocket $20,000 instead of $15,000. Okay, so there's some risk there as well. Things get a little bit sketchy if I have to have a surgery. If I have to have a surgery with my premium plan, it was only $200. With my inferior plan, it's 30% coinsurance. So that means if my surgery is $10,000, my portion is going to be $3,000. Of course, we have to look at deductibles. Those have to be paid. and out-of-pocket maximums and all those things. So that's when you start having to do a little more calculation. But I'm going from 200 to 30% in that category. Now, do I have any of those things planned? No. Can it happen? Yes. Likelihood? Not likely. If it happens, I'll be really upset and bummed and wished I would have chose the other option. But the probability of that actually happening next year is low. So I'm going to take a risk and save on that premium. Some other things that are also great about going to the what I call the lesser plan or the basic option instead of the premium option, my copays actually go down. So my copay is going to go down from my general provider from $35 to just $10. To see a specialist instead of $50, I'm going to pay $10. There's a catch though. I can only see someone 10 times a year. So I get 10 visits at $10 instead of 35 and 50 whenever I want to go. So here's the thing. I only saw a doctor that was actually under my insurance like 4 times this year. So, if I could spend 40 instead of like 200 in that space, right? Because if my specialist is 50 and I'm seeing that specialist 4 times, there's $200 there. So I'll be spending 40 instead of 200 there. Now, one of my specialists doesn't even take insurance. He's a cash guy. So I just pay him cash. I don't even go through insurance with him. And I see him twice a year at $200 a pop. So not saving any money there, but it is an option. So something to really think about. Other things to note in terms of the difference is there's no really other major difference. I also get Teladoc for free this year and next year. So it's part of both plans. So I'll be using Teladoc for the things that are easier to see. I actually really like Teladoc for dermatology quick issues. So it's been really easy to use, and it's hard to get an appointment with my dermatologist. It takes months to get in. Whereas the Teladoc, I can just send a photo and the next day they have a prescription for whatever my problem is. So all to say, think through different options. Maybe there's some things that you hadn't done in the past that are going to be helpful this year. But for both plans, there is no referral. So I can basically go to anyone in network for specialist or for general visits. So those are some things to think of. Also, look at your dental and your vision. My dental was going up this year as well. So again, I'm going to a lower plan for dental. So let's also talk about dental. Now, luckily, my vision has stayed the same. So I'm keeping that as what I've been using. It's a good plan. It works well. I get glasses and an exam every year. It really does work out just to keep my vision plan. But my dental was, again, going up this year. So my dental, I was paying about $58 and it's going up to like $60. So $2, who cares? It's not a lot. Usually I would be lazy and not even look at that and just be like, let's just go with the flow, right? So like I said, in the first one, I would just auto renew it. But this year I started thinking about, well, what am I going to need next year? My x-rays came back fine. I don't have a cavity that needs to be filled early next year. So likely if I got a cavity mid-year, I could wait 6 months and then they could fill it when I got my next insurance. So think about again, and only for a year, think about what you have coming up. If you have dental insurance this year and you need a cavity filled, go get it filled. And then next year, do your thing, right? Maybe you can go to a lower rate. So my dental insurance was going up to $59, but then I was like, okay, well, what's the cheaper option here? So the cheaper option was about $35. So what is the consequence of paying $35 versus basically $60 per pay period, by the way? So the preventive care is the same. So I'm paying the same. It's included. I mean, I'm not paying the same. The benefit's the same. It's included in both packages. I get to see the dentist twice a year. Okay. So here's where the kicker is. The kicker is in what I'm going to pay if I need a filling. So if I need a filling, instead of paying 30%, that was my portion, I'm going to pay 45%. I don't have a filling coming up. Nobody in my family has a filling coming up. If we need one, we'll adjust then. We'll look at it. Maybe we can push it out a year. If we have to pay for it out of pocket, I guess we will, right? But there's a 15% difference there. Fillings are actually not that expensive to pay. So the 15% is not a big deal. The big deal comes if you have a crown that's coming up, if you have dentures coming up, if you have you know, bridges that have to happen. If you have a root canal, that's the kicker. That's where it's going to cost a lot more money. So I'm going from my portion being 50% to 65%, which is a bummer. And then if we needed braces, it would be, instead of 30% my pay, my portion, it'll be 50%, but nobody needs braces in my family. So by changing my dental, I will pay about $650 less this year. So think about it. If I need a filling, that $650 is going to be fine. I'm going to be able to pay out of that money. Um, so it's not going to be a problem. The only problem is if I have a crown or dentures or a bridge that needs to be repaired. But hopefully, if that happens, we can wait hopefully that happens at the end of the year, right? So we can wait for the next year. So again, insurance is only yearly. So we can think about these things. None of that would be an emergency. A root canal would be an emergency. So then I would have to pay for that. So for dental, I'm saving about $650 a year. And for my premiums on my health insurance, I'm going to save at least $5,100, about $5,200. So between the two of those, I'm at about almost $6,000, $5,800 essentially is what I'm going to be saving just in premiums by following the first rule, which is not auto renewing, and looking at what you're actually using. So think about that in terms of what might be working for you. Okay, so the next thing is to consider life events and opportunities you have coming up that will allow you to adjust your plan mid-years. These are called life events, right? So we actually do have a life event coming up in probably mid next year, where my son is not going to be able to be on my dental insurance or my vision insurance anymore. So both of my kids are going to be on their own dental and vision. So they will have a life event because they will turn the age in which they are no longer allowed to be on. And then they will have to pick up their own dental and vision insurance. So because of that life event, I'm going to have an option to take them off my plan. So I will take him off my plan, and we'll save an additional, I think, $10 a pay period because of that. So look at what you have coming up in the future. Maybe if you're getting married this year, you might choose a plan that is best for the first half of the year, and then once you get married, you pick a new plan that includes both of you guys, right? So there are different life events that happen. Maybe you're planning on losing your job or quitting or all of that. Again, life event allows you to switch your insurance mid-year instead of waiting for open enrollment. So check with your HR person. Make sure you check everything specific to you. But in my case, we are going to be able to make some adjustments mid-year. So consider the events and opportunities you have to make an adjustment kind of middle of the year. The next thing is to consider using telehealth. I love the teledoc. It's so easy and so quick to get help. Instead of going to an urgent care, which in the future will cost me $25, I can just call the teledoc and give them my symptoms, talk to somebody over the phone. And then a lot of times they're able to prescribe a medication that's going to help me. Dermatology appointments, usually I can just send a photo in and then I'll get my prescription if I need one within the next day. So, and that is zero out of pocket for me. And I know that there are other plans, like Amazon has a tele one that's relatively fair in price, and your plan may even include it as well. So look at that as like a cheaper option than just going to the doctor and paying a copay or paying your coinsurance or your deductible or whatever it is for you. The next thing is compare pharmacies. Like, it's more expensive sometimes for my CVS prescription than it is to go get it at Costco. So if I have a medication that I have to take that is expensive, I'm shopping it around. I'll call Walmart, I'll call Costco, I'll call CVS, I'll call Walgreens, I'll call Safeway, and find out what they are charging for this drug. And then oftentimes you can look at, actually 100% of the time, you can look at your benefits and understand how much of that pharmaceutical is going to be your responsibility. So you can do a quick calculation, find out what is cheaper, and go get that one. And if you're paying for cash, it's even easier. You don't have to do a calculation. You can just take the number they give you and choose the cheaper option. Another also something to think about when it comes to medical, this one has been really bothering me this year. I pay, it's so weird. I had a doctor prescribe a tube of something for me, and she prescribed it for a month, and it came in 45 grams. I had another doctor prescribe it for me later at a lower dose. Same tube, 3 times the price because it's a 3 month supply now instead of a 1 month supply now. A lot of times, if you do get like instead of getting a month supply, you buy like a 90-day supply. There's usually a break in price depending on your insurance, so maybe you do that as well. Think about sometimes if you get mail order, it's even cheaper too. So there's a lot of different options for you as long as you know your plan. The next thing is to take advantage of those bonuses. So my insurance will give me a bonus. It's basically like healthcare money that they put into an account for me that I can spend on healthcare things like office visits or medical or pharmacies and things like that. So if I go get an annual, they're going to give me $120. This year in 2025, I had to complete like 3 different challenges, and they gave me like I think it was $180 or something like that. It was like 150 or 180. I don't really know. They gave me some money. I used it. So I did all the challenges that they wanted me to do. For next year with the lower plan, there's only one thing I can do, and that's go get my annual. If I go get my annual, they're going to give me $120, and that $120 I can use on gym membership. I can use it on, which I won't because I get that for free. I'll tell you about that in a second. But I can use it on any pharmaceuticals. I can use it on office copay and stuff like that. So only medical stuff. Actually, no, they have, I can spend it on some things. They have some like, it's like a marketplace that they allow you to go in and you can use it. I think there's even like food delivery that I could get with that money. I never use it that way, but I can. So take advantages of any bonuses that are provided by your insurance. The next thing is to take advantage of those free memberships. You guys, I know so many people that pay for gym memberships that don't have to do it. So if you qualify for like a silver sneakers program with your insurance, you can get your gym membership for free. I think Planet Fitness is included. I know a lot of community centers are included. Sometimes LA Fitness is included. So if you have silver sneakers and you're at the age in which they offer it for your insurance, you can get all that for free. I know many people who do, and I also know many people who have it that don't. They pay for their membership. So try not paying for those memberships. That can save you a lot of money, hundreds of dollars a year. I do have a membership through my insurance. It's not Silver Sneakers, it's something very similar. And I get my Planet Fitness membership for free. And then I upgrade to the Black Card, which is like $10 a month. So I do pay $10 a month because I really like the Black Card. I like all the extras they give you. It's like a spa and a gym in one. So, and then I also get my line dance lessons included in that because there's another gym that does the line dance classes. So, and it's part of that same program. So I get those included as well. So look at what your health insurance may be providing for benefits like that. The next thing is to use your FSA, your flexible savings account, or your healthcare savings account wisely. So you have to decide during open enrollment what you want to put in for your flexible savings account. An FSA account is what it's called. And HSA is a little bit different, so I'm not going to talk about that. But for FSA, I think we can do up to $3,400 this year. I'm not going to do the max because I'm not going to use it all. But you can. And Lonnie says that you can roll over $500 if you don't spend it all. But if you don't spend it all and you can't do the rollover, then you lose it. So you have to be really cautious and think about how much you're going to use next year and try to guesstimate that on what you're going to be spending. So make sure you don't lose that money, but make sure you do a good job guesstimating it because it can save you, depending on your tax bracket, right? Could save you 22%, 24%. If you're really rich, 40%, right? So you don't have to pay taxes on that money if you use that money for certain things related to whatever the FSA program says. So for me, I use that for, again, office visits. I use it for my glasses, my contact lenses, dental visits, all of that stuff. So I don't want to pay taxes on things if I don't have to. So basically, it's like getting 20%, plus for free, or 22% or whatever for free. So instead of paying taxes on that money, you get that money without paying taxes on it, and then you use that money to spend on like healthcare things. So the next thing you can do is to ask for cash pay prices. So I do actually see a doctor that doesn't take insurance, and so I pay cash. And the fee for him was $500 for the evaluation, $200 each visit. Before, my specialist would have been $50, so I was over. I'm basically paying him $150, basically what the insurance company would have paid on their behalf. So I just pay all that out of pocket. There has been an instance where I needed a DEXA scan where my insurance would pay. What I would have to pay with insurance was like $100, and then I asked him for the cash pay price, and the cash pay price was $80. So it was cheaper to pay cash than it was to run it through insurance. That also happens with my chiropractor as well. It's cheaper to pay cash with him than it is to actually go through insurance. So, in fact, I don't even think he takes my insurance anymore. I think he's another one that I'm just paying cash for instead of using insurance. So again, if all your doctors are not taking your insurance, consider getting a different insurance, or, I hate to say it, maybe just getting the emergency insurance. So ask for cash pay prices. It may actually be even cheaper than what you're paying with insurance. It was in my case, especially for my DEXA scan. The next thing is this one's it should go without saying, but it's something I need to be reminded of, so I'll remind you as well. Build healthy habits now. So try to eat better as best you can. Try to get to the gym. Find something you love doing. I love doing line dancing, and so for me, that's my cardio. Do I like going to the gym for my strength training? Absolutely not. But I will, because I have the black card at Planet Fitness. And that means if I go, I get to do the total body enhancement and a massage before I actually do my strength training. So it just kind of motivates me to go to the gym. Lastly, my friend had her insurance went up 5,000% this year on the Affordable Care Act program on the exchange. So she is trying to think of some clever things. And if you have any ideas to help her out, let me know below. In fact, why don't you share your most favorite way to save on healthcare below? That would be really helpful to share with me and our community. I hope you'll do that. So what she is going to do, her premium, I think she was paying like under $20 a month, and her premium went up to like 500 plus a month. So she cannot afford it anymore. So, unfortunately, she is thinking about opting out. I hope she'll pick at least one that would cover her in like a drastic situation, but she does not have like a lot of assets, and so she potentially could be covered under Medicare in an extreme situation. So I think right now she has decided to forego her insurance, but what she's doing instead is she's bartering with a naturopath. So she loves her naturopath. The naturopath has been doing great for her. And she's actually going to barter time. So she's going to barter her skill of, I think, billing and administration. And in exchange for that, she's going to get her healthcare for free. So I thought that was such a clever idea. If you can't afford healthcare and you're unable to, participate this year because everything has gone up, if you have someone that you can work out either a cash payment plan with, or maybe some kind of program or membership they offer. I know my chiropractor has a membership plan you can join. Look around for stuff like that. But I loved her idea of bartering for her health this year, and I thought that was something I wanted to share with you as well. I hope this video was helpful to you. If it was, don't forget to subscribe. We have a lot of fun tiny house stuff coming up soon. I know I haven't done a lot of that. And of course, helpful tips to help you take the next amazing blessed step forward. Have a wonderful day. Bye.